name is Dr. Hillel Mazansky, and my website is www.GIANINC.com, facebook.com/guided imagery for my daily YouTube video health tips, whereupon this one will be placed as well, and twitter.com/Gianinc, Gianinc. Today we are going to discuss a situation called irritable bowel syndrome, or as it's known in some countries, spastic colon. Irritable bowel syndrome is extremely common, especially among young females, and it tends to present with recurrent lower abdominal pain, sometimes some bloating, and it can also be associated with intermittent diarrhea or constipation, or a combination of both. When one examines patients with this irritable bowel syndrome, you can actually sometimes feel that the left side of the lower colon is hard like a tube, and it is due to the spasm around the bowel that causes it, hence spastic colon. It causes quite a lot of distress, and it tends to be intermittent. The main cause for irritable bowel syndrome is stress. It is always associated with stress of different types, some more severe, some less severe. And this condition leads to doctors doing all different types of tests, up to barium enemas and flexible sigmoidoscopies and colonoscopies and MRIs. It is just unbelievable the amount that the tests and the cost of the tests that are done, with the amount of radiation that these females especially have. And all that it is pure and simple stress. The medication that is prescribed is usually antispasmodic medication or pain relief medication. If the diarrhea is bad, then they're given a medication to constipate them. If they're constipated, they're given medication to have their stools a little looser, less constipated. And all that it really needs, my friends, is a proper nutritional program, and we request the patients to have a high fiber diet, plenty of fiber, fruits and vegetables, and the stress needs to be managed. Again, in allopathic medicine, the patients are going to receive antidepressants or various medication to calm them down if they're anxious and tense. What's really needed is just a good nutritional program and one session of medical hypnosis to probe the subconscious mind to try and find out what the real cause of the stress is. Once you have discovered the actual cause, the treatment is relatively simple. A few therapeutic sessions of counseling or going to groups, and the whole problem is resolved. And that is the correct way of dealing with irritable bowel syndrome or spastic colon, not with expensive investigative radiation and techniques and many different types of medication. That might work for a while, but it's not treating the root cause. It's treating, as we say, symptomatically. You're treating the symptoms instead of treating the cause. And we have had so many patients who have responded tremendously well, terrifically, just because they came for a hypnosis session, 1, maximum 2, recorded the session, listened to our voice twice a day, and that was the end of the story. It's so simple when it's done holistically, but extremely complicated when it's done allopathically. I thank you very much for listening. My name is Dr. Hillel Mazansky. Thank you.